everyone. My name is Dr. Gail Roboz. I'm a professor of medicine and the director of the leukemia program at Weill Cornell Medicine and the New York Presbyterian Hospital in New York City. I've also had the privilege of working with the AAMDS International Foundation I was trying to figure out how long. It's a long time. It's definitely over a decade. And during that time, I have had the honor, privilege, and fun of being involved in the Patient and Family Conference multiple times over the years. And this conference is very unique this year for reasons that we don't like. So we don't like to be virtual because of COVID-19. But at the same time, we're also very thrilled that the organizers have been able to recreate this event as a virtual one because it's really important for our patients and our families and caregivers to have this opportunity. It's a super unique meeting where we try very hard to combine not only cutting edge research and education and clinical trials and updates for our patients with these rare diseases, but also it's bonding time for patients and families and caregivers to see that there are others out there going through what they're going through. They get tips from each other and advice on how to trek through all of the difficulties of these illnesses. And the point of our little video today is actually for me to have a conversation with perhaps the world's most famous MDS patient. So Robin Roberts, actually a household name, decided to share every aspect of her story with MDS to educate the world. And actually, Robin turned MDS into three letters that people actually know what they mean now, when the world basically didn't. So it is my huge privilege and honor and fun to welcome Robin from wherever she is in her house to this virtual meeting. Hi, Robin.
Hi, Gail. It is so great to see you. And I made my mess my message. It wasn't something that I chose to do. It chose me. And I'm so grateful for this foundation. I'm grateful for the work that you have done with it. Sometimes I can't get in touch with you because you're here, you're there, you're all over the world, literally. And it's great that you're doing that because I think of the advancements. I was diagnosed in 2012, as you know. And the advancements in that time is something that just warms my heart. And I'm so appreciative that I've been given a platform to be able to inform people. And just what you said, I didn't know anybody who had MDS, especially someone my age. And so I'm grateful that I've been able to share my story. And I've heard from countless, not necessarily the patients, but their families who have reached out to me over the years. And I've been able to share my story with them.
Well, that's actually been so super generous of you. And I know because I get the fun texts when my patients are accosting you at various book signings or other things, and you're always so nice to let them come up for a quick picture. It matters so much to see people doing well. I mean, almost nothing that I can say can be as reassuring as seeing another patient looking and feeling well. And it's just it's so great of you to not just be one and done and put this in the rearview mirror and totally forget about it, which you completely would be in your rights to do, but to still come back and talk about it and remember some of those hard days so that you can help other people get through them.
Everybody's got something. You know, my mother, she said that everybody's got something. And that was my something was MDS. And when I say everybody's got something, you know, there's that I don't look at MDS as being a tragedy. The tragedy would have been had I not taken the time to learn, like, why was this placed in my path? What am I supposed to learn about myself, learn about this disease? And more importantly, what am I now able to share? And that is something that has been in my DNA from my parents. They were just always about being a public service. And so it's very important to me to be able to let people see me, to let them see that I am a symbol of this too shall pass. Yes, you know firsthand, Gail, it was not easy. And I love when you say patients reach out to me and say, to reach out to you and say, give me what the medicine or whatever that you gave. Like there was nothing special that I received. It was what every patient that you see receives. But it was as much mental as it was physical. And I'm so grateful to you and the MDS community. You all are wonderful. You're collaborative. It's not like, remember when you used to take a test and some kid would be like that because they didn't want you to cheat on them? You all, it's so different. You're like, let me share this information. I don't want to just help my patient. I want to help everyone who is facing this. And so I have just been just so amazed at this phenomenal community that is inclusive and wants to help. And so I've just done my small part to do that. But I am immensely grateful to you and your staff and everybody that has crossed my path. And so it's the least that I can do to be here with you and to be here with a conference. I would have loved to have had a conference like this because I didn't have anybody to reach out to. And I think that's so important to know that you're not alone.
You know, I want to pick up on one thing that you said, which is, I think, so eye-opening for patients. So I have a lot of patients, and especially some of the older ones, who are very sheepish about seeking a second opinion or asking for help or collaboration. They worry about offending their doctor. They worry that, well, but I like my doctor. I wouldn't want to bring up something. I wouldn't want to offend. Your point about all of us being connected and collaborative, I just want to bring that home to the patients because that's also part of the point of the foundation. Reach out, make those connections. It is a collaborative community. I'm not here to upset anybody's doctor. We want to work together. This is a rare disease, and there might be things actually that patients can get access to, which their treating physician may not know about, but may be really thrilled to learn about. So I think that one tiny point, especially for the older patients who are worried about upsetting their doctors by maybe hurting their feelings with another opinion, get the other opinion. It's a collaborative community. Nobody's here to hide their test paper, like you're saying. And I think that we have seen over and over and over again that the calls to the foundation or the calls to our offices, they make game-changing, treatment-changing decisions for patients.
And you in essence were my second opinion. I was another doctor, a great doctor. I was actually receiving treatment at the time that I met you via television. Somebody in your foundation had reached out to you that day because I had announced on Good Morning America that I was diagnosed and that I was going to have the bone marrow transplant. And thank goodness my sister had already been tested and she was going to be my donor. And so we go on television that morning. Your foundation reaches out and says, you know, there's going to be a lot of press opportunities, sends you out to speak. So I love this story. So I'm at this doctor's office. I'm receiving treatment. And I'm just in, the doctor hadn't done as well as I would have liked to have explained what was ahead of me. Great doctor, but still not explaining for me to understand. So I am there getting treatment, getting chemotherapy, just to kind of get me prepped for the transplant that was going to be a couple of months ahead. So I'm there in the doctor's office receiving the chemotherapy. I see you on CNN, and I'm looking at you, and you're explaining it like I have never heard it before. The nurse, and again at a competing hospital, she sees how I'm looking at you. And her doctor walks out, she looks at me and she says, do you want her number? Meaning your number. I said, absolutely. She gave me your phone number. On the way home, I called you. Remember this? I called you from the car. You were great. You knew that I was with another doctor. And you said, look, I'm here to help. I'm not trying to take this person's place, but if you need me for any reason. And I'm thinking, why am I going to stay with this doctor when you're the one explaining very well with me? And so the doctor was very, very good. I was with another doctor, a transplant doctor, that it wasn't the same situation. This particular doctor took offense to the fact that I wanted to change. I just didn't care for this doctor's bedside manner. And I was able to switch the transplant, Dr. Sergio Giralt at Memorial Sloan Kettering. And the way that you all work together, it was like a la carte. And I'm glad you bring this up, Gail, because it's so important. Look, my mother and father, I blow kisses to them in heaven. They were older and they went through their health issues. And my mother was one of those like, oh, I don't want to offend this doctor. I don't want to offend that doctor. You are fighting for your life.
Yeah.
Why would you not want to have the best possible care? And so I'm so grateful that I spoke up. I'm very grateful to this nurse who gave me your number. But again, it is different in the MDS. In this community, I don't know how it is in other practices, but I did find, because I went to different, I went to Dana-Farber, which is great, the Hutch, which is, they created this, and they were all very respectful. And it's not one size fits all. What's going to work best for you? And so I took all the information and I was able to make the best decision for myself.
I think in anything, if a doctor can't handle another opinion forget it, just get a different doctor. I mean, you get a second opinion on a toothpaste or a pair of slippers, right? These are life and death issues. You need to be comfortable with your team. And actually, okay, leukemia doctors are always looking for the silver lining. I'm looking for a silver lining in COVID. That's tough to come by. But one thing I'll tell you that has been truly great is that during the pandemic, our ability to reach out and help across state lines, across borders, insurances made telemedicine visits okay across state lines, clinical trials that normally would have taken months or even years to open, boom, 10 days later, we were enrolling patients onto trials. And also, we've had the ability, due to the pandemic, to do follow-up for patients on existing trials that we've never been able to do before. We've never been able to ship oral medications or to have study visits with patients without them coming into the treating center. So a lot of us who do this as our career, who are trialists, have actually been begging and moving the companies to say, don't go back on any of this for diseases like leukemia, like MDS, like aplastic anemia, PNH, rare diseases where you have people in pockets all over the country. The feasibility now of the collaboration, of the telemedicine, of being able to get onto a clinical trial without necessarily having to fly all over the place once a month, which you might have had to do before, these would be positives. Let's hang on to them. And I certainly want to encourage the entire audience to take the time, make sure that you do have an expert involved in your care. MDS, aplastic anemia, PNH in particular, these are rare diseases. It is totally possible to have a treating physician who's actually never had a single case before. That doesn't mean the treating physician is not fantastic. It means it's an incredibly rare disease. And it is totally the Foundation's mission to provide support and education and resources and kind of hand guidance of where you can go for additional opinions, for clinical trial consideration, for all of those things that make you secure that you're getting the right treatment. And for extra credit, there are lots of friends and family who've offered phone numbers or emails or to be able to call them, that if you just need to talk to someone to get the reassurance that, yep, I'm here, I went through it, I'm still standing, I still feel good, or, I've taken care of my mother who went through it and she's doing well, something to hang on to for that extra hope. And I think you in particular can speak to the importance of having those around you rally and be ready to help and be a huge source of inspiration.
I don't like to use the word survivor, you know this. I want to be a thriver, and I want all of us going through this to not only survive it, but to thrive it. But I'm going to turn the tables a little bit. I want to ask you a couple of questions here because you bring up a lot of good points. And I'm here at home. We're in the middle of the pandemic. I'm at home based upon your advice to get out of New York City. I'm home in Connecticut. I've been broadcasting from my basement here in Connecticut for Good Morning America. How can we, those who have those underlying conditions, we hear, we watch and we hear what people say about underlying conditions. What are some of the things that we should still be doing now, those of us like myself, who are very grateful that we're doing as well as we are, but knowing what's out there right now? What do you suggest?
So I have been doing webinars from the beginning of March through now. And the evolution has been absolutely extraordinary. I mean, the first time that I went on the air with you, but I also have been doing educational and oncology based and sort of more in the field webinars for colleagues across the country. So we were scared March was not funny. I mean, this is our city, and there's a pop-up hospital in the middle of Central Park. And I was walking back and forth to the hospital every day in March, not seeing a soul on the streets. I mean, the city was crazy. A lot of what happened, actually, the statistical modeling didn't pan out in ways that makes it obvious for the world to what to do now, right? So we know that New York and Italy and behaviors in different countries at different times in different age groups, it's tough to figure out. I can tell you that there are patients that I've treated, MDS patients, leukemia treatments, who I said, oh no, no way, they got sick with COVID, they're not going to make it. They did great and fine. Several patients truly with minimal symptoms, and others who were much healthier who had trouble. So even there, I can't tell anybody with MDS that just because you have COVID, you're definitely going to have more likelihood of getting the disease or more likelihood of doing worse. We are not seeing that. And the world is trying very hard to put the data together so that we have some statistical experience with MDS patients across the world and with leukemia patients across the world to see how they did. So the good news is, just because you get the diagnosis, it is not the guaranteed death sentence that we thought it was in March. That said, this ain't over. I wish it would be. I would be so happy to be done. The mask indentations in my face at the end of the day, I feel like Darth Vader taking off the mask. It's a nightmare what's underneath. I wish we were done, but we're not. So for everybody, for right now, what we are saying is that the things that matter seem to be the close spaces with a lot of people. So that little tiny sushi restaurant in New York that's crowded and packed in and you're sitting 2 people apart, a lot of MDS patients probably shouldn't be eating sushi anyway, but the point of the example is the proximity, close proximity to a ton of people. Watch out for that. Packed elevators, packed spaces, subways if you live in big cities. I think that the masking at the moment is kind of the best that we have. We went from thinking initially that wearing a mask wasn't going to do very much. But the issue was, initially, we were thinking of wearing a mask as protecting ourselves. You probably aren't doing much of that unless you're wearing an N95 mask. If you have a cloth covering, though, you may very well be cutting down on the transmission to those around you. And for right now, that's the best we've got. So it doesn't really make sense to me. There are a lot of objections to wearing masks, and this is not going to be a political discussion of any sort, but masks are protecting others, we think. It's kind of the best we've got right now. People who are saying they're not going to go out again until a vaccine is available, I wouldn't do that. There are many viruses for which we still don't have vaccines. So I wouldn't say that that's coming in 5 minutes. And I would say, go out, be wearing masks, try to avoid close spaces. I wouldn't do that stadium or that rock concert or that big meet right now. I would keep face covered. I have Purell or equivalent hand sanitizer with me everywhere. I don't step out, and my rule, and I've learned this now, nothing goes to my face unless my hands get hand sanitized. Nothing. It took a lot of training. I mean, you and I were watching this in March. Everybody was touching their face every 5 seconds. It's very hard not to touch your face. You have to actively train yourself. Your hands don't go anywhere near your face unless they have hand sanitizer on them. And for right now, that's going to be the way of the future.
Well, you know what? A lot of us who've gone through this, who've walked this path, this is things that we were told to do anyway. I just,
Yeah.
so like I was like coaching other people.
Yeah.
Elbow, we already were in a state of having to be aware of our surroundings. So it wasn't so much different for us. You brought up about people caring and caregivers, and I'm glad that you did that earlier as well. And I just want to stress and bless these people who care for us, who are going through this. And we're just trying to do the best that we can. We have our marching orders. It's almost easier for the patient because we know what we're supposed to do. Our loved ones are on the sidelines and they're like, oh, and I hear from caregivers more so than I hear from the actual patients. And I just want to, I cannot express enough, and I know this because of my partner, Amber, you as a caregiver, you need to take care of you as well. please. I mean, Amber had to do yoga. She had to, there was a lot of things that she was going through. And the one thing that she has told me to make sure to tell other caregivers, in addition to, what do we need? We don't even know. Please don't ask us. Just figure it out as best you can. And it's not one size fits all. There'll be some people that you're caring for, and they'll be absolutely able to tell you what it is they want or need. There'll be others that we can't. And just kind of, I hope that you would know us well enough that you would know what we need. But sometimes it's just, I remember, dear friend Gail, I was really having a tough time. And we had a rotation system with the caregivers, because to get to that 100-day mark after transplant was so vital. And I was in the hospital for 30 days. I was able to leave, and I thought I would be so happy to leave. And I was frightened because I was not in my safe bubble. So I'm at home, and we would have a rotation of people coming in on the weekends, especially to allow Amber, my primary caregiver, to get a little bit of a break. And one friend, she just sat there, didn't say anything. I just wanted to be in silence. She wasn't trying to fix anything. She was just there. So you kind of figure it out as best as you can as a caregiver, but it's very challenging. But I don't know where I would be if I didn't have my family, Amber, the circle of friends who really on their own, they had almost like a whiteboard where they placed who was going to come in and do what, things that I needed. I had my transplant in September. November for Thanksgiving was a traditional time for our family to be together. As you know, Gail, my mother passed away a short time before my transplant, which I still can't even really talk about that. My two sisters came up to be with me, and I didn't even want anybody. I didn't want a traditional Thanksgiving, but they came anyway, and it was so wonderful to see that they took the lead. So don't always wait for the patient to be able to articulate what it is that we need or don't need. But I do emphasize, as caregivers, please, you need to take care of yourself as well, so you can be able to take care of your loved one.
Well, that's a perfect lead into a little bit of a wrap up for our session today. So the foundation is hoping to help all of those areas and all of those groups. So there are resources for patients, there are resources for families and caregivers. And I think a lot of times, to your point, a little bit of guidance from somebody other than the patient, because the patient may not be able to tell you exactly what you should be doing and you may be overwhelmed. I think you want to separate out the science and the education and the medications, and then the softer stuff. What are the things that I could offer as a caregiver that may be valuable? Please reach out to AAMDSIF. They're there for you. We are updating materials continuously on the website. We have pretty immediate access to experts. So I think that if somebody's calling in with a science question or a clinical trials question or a what should I do question, it's pretty much instantaneous. And if I don't answer in about 2 seconds, they'll ping me again. So I think we want to emphasize to the group to please enjoy the virtual conference, share it with friends and family who may not know about it, reach out to us, and most importantly, stay safe and well.
I think someone's calling right now. I don't know if you can hear my phone going off right now. I felt like somebody was calling right now. But let me just add something too, Gail. Thank you and bless you. Thank you for the work and your colleagues are doing. Thank you so much for this foundation. I cannot get over the great strides since my transplant in 2012, and the fact that the collaboration is continuing, that you're having a conference like this, that people can gather like this virtually. Probably more people are able to see this than are able to travel.
Maybe.
And I'm just so immensely grateful. My family and I are just so eternally grateful to you and your family. And I hope that your folks are doing well. I know your folks are with you, and I just think of you all the time. And I thank you for this time that you allowed me to share with you. And I can't believe you. I let you ask me more questions than I asked. This was a
That's probably never going to happen again.
Don't take my job. I can't do your job, so don't take my job.
See you very soon and be well.
Be well to everyone. Blessings.
Bye-bye.